Hello, my name is Alma. This is Cesar, Carla, Alexia, and Benjamin. And do you guys know what skin cancer is? Okay, well, skin cancer starts in your cells. It may affect your tissue, which causes it to die. And most of the time, it starts as a mole or a rash, just like other cancers cause a lump. But what doctors try to do is prevent the skin cancer to get to other parts of your body. So most of the time they will try to cut it in a football shape size. And the risks for skin cancer are if you don't cover yourself in the sun due to the ultraviolet rays. Also, if you have light skin or red hair or blonde, or if you tan easily, then that's also a risk factor. You can also get skin cancer depending on your genes and your history and your medical history.
What puts you in a higher risk for skin cancer? Skin that burns or freckles rather than tans, blue or green eyes, blonde or red-headed, or light-colored skin. Your medical history could also increase the chance of getting skin cancer. For example, you have history of sunburns, especially by the sun, have close blood relatives that has skin cancer, had an X-ray treatment such as an acne treatment for a long period of time, have a burn either by the sun or by an accident,
There are three main types of UVA rays. These are the rays that affect skin cancer and make you get it. There's the UVA ray, which ages skin cells. There's the UVB ray, which burns skin cells. And there's the UVC ray. This ray cannot get through our atmosphere, so therefore is not a common cause for skin cancer. There are three different types of skin cancer. There's basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the most common type of skin cancer. It appears in many different shapes and sizes. It usually appears in skin that has overexposure to the sun. This skin cancer is not as deadly as the rest. Squamous cell carcinoma is the second most common type of skin cancer.
Can you get melanoma from different kinds of sunblock or sunscreen? It hasn't been proven to cause melanoma, although this question's been asked various times. Tests and experiments are being taken to prove whether it does or doesn't. People have said that this has been the cause of their melanoma. Sunscreens of zinc oxide and titanium dioxide act as physical blockers. They're thick, heavy, and white. ABCDs of melanoma. Ask your parents to help you check your body monthly for any moles that fit these descriptions. If you do find a mole that looks like these, please ask your parents to take you to a doctor. Asymmetry, when one side is different than the other. Border, irregularly in a mole's edge. It's not round, it's oval shape. Color. It's multicolored moles and spotted. Diameter. The mole is larger than 6 millimeters. Evolving. If the mole is changing, it becomes different than the rest. Treatments after diagnosis. According to dermatology chief Frederick Phil, skin cancer patient population has increased. During early diagnosis, the mole is cut into a football shape and it leaves a big scar. After it's cut and lymph nodes, chest x-rays, and blood tests are checked. Chemotherapy also plays a role in advanced melanoma cases.
Skin cancer prevention. Be sure to cover up your skin so that the sun won't affect you directly. Use long sleeve shirts with reflective colors and wear a big hat. Sunburn blisters risk factors. Light skin, red hair, or people with type 1-2 skin run more risk. Anybody may be diagnosed. People exposed to the sun in a young age may develop melanoma later in life. Preventing skin cancer. One way of preventing yourself from skin cancer is that you must use sunscreen that are SPF 30 or higher and apply 15 to 30 minutes before sun exposure. Using sun protective clothing like long sleeves, big hats, sunglasses protect your skin in the sun. Avoid midday sunlight 10 to 4. Avoid tanning boots because they contain ultraviolet rays. Melanoma may also run in your genes. Sunscreens we recommend. We recommend you to use sunscreens that are SPF 30 or higher and apply your sunscreen 15 to 30 minutes before exposure. We recommend this because using sunscreens lower than SPF 30 don't have as much sun protection as the SPF 30 or higher, 60 and 70 SPF depending on the sunlight time exposure. We also recommend you to use sunscreen even though the sun is not out or you don't think you're going outdoors. We also recommend hypoallergenic lotion creams. Thank you.